All my friends think I'm going to surgery as opposed to having one done.
So I'm Dr. Mehmet Oz, usually. Today I'm Mr. Mehmet Oz because I came to my hospital to get a colonoscopy.
This way.
Colonoscopy, part 2.
You're not going to change or anything?
I am. I'm going to take
Kidding,
this
I'm
off.
kidding.
I'm going to take this off.
I turned 50 last year, had a screening colonoscopy. They found a precancerous polyp. Because of that, and because I had eaten some lentils the day before the colonoscopy, which made seeing the colon a little more difficult, we decided to get a follow-up.
Dr. Oz, my name is Teresa.
Hey, Teresa. Hope there's no quiz Teresa later on.
No, that's
Amalia,
okay.
Teresa, and Lydia. Where did Lydia go?
It was supposed to be done 3 months after the first one because we could not see parts of the colon, especially the very beginning part of the colon, which is the hardest part to get to.
Here.
Once you get changed and they take your blood pressure and basic vital signs to make sure that you're safe enough to go into the room, you're walked into a bed, which is inside of this place that's fairly complicated looking because they've got the colonoscopy set up already there and they have monitors every which way. And they put an intravenous line in your arm.
This is just my finger.
They give you a sedative, which pretty much takes the edge off the rest of your day. So then they put this big black tube, it just looks like a python, which is a heck of a lot longer than it seems like it needs to be, into your bottom. And they pass it rapidly up to the cecum. So they go all the way up. If it's, they go up, from the starting from behind, go up this way, around, down through across, and over here. And right here is the cecum. It's the very first part of the large intestine.
All right, I think that is, in fact, a tiny polyp.
Turns out I still have a polyp.
Can we have a fortress, please? Can you please put it in because it is so subtle?
Are you going to take another bite?
Yes, I am. And I can do it myself.
Oh, okay.
Another one. It was growing in there. We found it. Dr. Lepoux took it out. We'll find out what kind it is the next day.
Do you want me to do it?
But it means that my colon is predisposed to making polyps, which does complicate my life a little bit. I'll have to have more frequent colonoscopies.
That is about as subtle a polyp as you
I would
can
have
find.
gave you a
Seriously.
stop if you...
So I think, had we waited a year, it would have been a little bigger, but it wouldn't have been a problem.
I didn't mind the size, I minded the pathology.
It's a wonderful example of how you could have no risk factors. I don't have any family history. I don't smoke. I don't have a bad diet. I'm not overweight. I don't have any of the risk factors for getting colon cancer, yet I still seem to be making these polyps, which we know over time, in enough cases that it makes us worried, will evolve into cancer. I've been screened. Now I've had a formal, appropriate screening, and I don't have any precancerous elements left in me. I'm just going to have to repeat it probably in about 3 years. Listen here, if you're 50 and healthy, you got everything going for you in life, and you are foolish enough to not get a colonoscopy, then you could be dealing with colon resection, chemotherapy, and death 5 to 10 years later. So, and I just don't think it's a good trade-off. There are some things that are knowable in life. There's some things that are not. If things are knowable, know the answers. Your colon is a knowable phenomenon. And unlike other tests where you might get bad news and then not have the ability to deal with it, with a colonoscopy usually is not only diagnostic, it's therapeutic. You're cured.